Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with a weekly podcast of the Common Sense MD. Hopefully, I'll give you some knowledge about something health-wise. That's our purpose at Performance Medicine. Today, I'm going to talk about something that's really important for your health, really what you eat as it relates to your gut. And I'm going to hit at it from a little different angle today because I want to tell you about a personal experience that I had recently that I had a really upset gut for a while. And there's nothing like experience that will teach you things. And this was an unknown experience for me in my lifetime. So, it was a pretty long ordeal. And it all started with when I had to take a few days of a steroid, prednisone, because I had really inflamed my knee where I was on crutches playing pickleball. And then, so I was on that, and then I had to go on an antibiotic because I got the second round of a mild case of COVID, which can upset your gut as well. So I had kind of like the perfect storm with prednisone, which can definitely upset your gut, and then I had an antibiotic, Z-Pak, and then I had COVID. And those three things wreaked havoc on my GI tract, unlike I'd ever experienced before. And I mean, I tried everything to get this gut back to normal. I tried so many things that make your head spin. And the only thing that really finally helped me was really just changing what I ate. And what I did, I tried the carnivore diet. That's what I'm going to talk about today is the carnivore diet because it seems crazy because eating red meat all the time, but there are variations of it. And I'm not saying that I would suggest it to everybody. Certainly I wouldn't. But maybe to get you back on track, and maybe if you have certain autoimmune diseases and different conditions, then it's certainly worth a try. It gets a lot of bad press, but really it's a pretty reasonable diet to try if you have problems. Again, never change a winning game plan. If you feel great, you're healthy, you're lean and fit, and you are happy with your gut, then please don't change a thing. It's only when you have a losing game plan that you need to look at something different. So I kind of did a deep dive on the carnivore diet. I've always espoused a low carbohydrate diet and some intermittent fasting, which plays right along with a carnivore diet. I mean, it's definitely a low carb diet, and intermittent fasting certainly plays a part into that. I mean, as lean as I am, I lost 10 pounds with that gut dysfunction. So I really needed to do something that would help me. I was starting to get worried. But anyway, so it finally got better, and I'm pretty sure it was because I changed my diet because I tried every kind of supplement and intestinal antibiotics, everything I did, and nothing really seemed to help much. So the carnivore diet, what is it? When you think carnivore diet, you think, well, all red meat, or all meat at least. So the two guys that I really read books on and went to their podcasts and kind of did a deep dive on, Dr. Paul Saladino. Now he's the main one that people think about when they think about the book he wrote, The Carnivore Code. And he's certainly an interesting doctor. I mean, he takes it to an extreme from a lot of angles. And he's changed his idea about eating pure red meat all the time. He doesn't do that anymore. He adds certain fruits and definitely honey in there. And I will admit, I even tried the low FODMAP diet, and it really didn't straighten my gut out, but this did. The other doctor is Dr. Sean Baker. Now, he's an orthopedic surgeon who got kind of disgusted with having to turn down patients for surgery because they were obese and they were too high risk for surgery. And so he got into looking at integrative medicine and functional medicine like we do. and he doesn't do orthopedic surgery anymore. He's just a functional medicine doctor. He's got a really good podcast called Revero, and he's even a more strict carnivore than Dr. Saladino is. Um, and again, there's different versions of it. Dr. Saladino does not eat chicken, fish, or pork. Um, so the whole deal with this, because you're asking yourself, are plant fibers good for your gut? Well, in a lot of cases, no. And what does that mean? That means cutting out vegetables that we've always been taught to eat the green and the purples and eat the rainbow, eat veggies. That's the first thing you learn with any nutritional course you take. Well, for some people, a plant-based diet is a horrible thing for their gut, at least if they can straighten it out. There's good things that come from vegetables, and there's bad things too. So for some people, they can't tolerate vegetables. Patients have told me for years that, I would say, increase your fiber. Or how? Well, eat more fruits and vegetables. Well, a lot of times when people ate more fiber, it made their guts worse. So you have to look at it from a lot of different angles. And again, everybody's different with their diet and their gut. That's one thing you have to learn in this business, that you have to be able to adjust and use what works for certain patients, because everybody's gut microbiome, that balance of good to bad bacteria, is different, certainly. So even, I thought at one point I may have SIBO, small intestinal bacteria overgrowth. And it's kind of an onerous thing to get tested for that. So I really didn't test for it. It's almost like, a guess. But I tried some stuff for it that really didn't work. Dr. Saladino really thinks that maybe SIBO is not a real thing so much, and it's more of an autoimmune and a motility-based disorder. I know one thing: if you avoid sugars, probably gluten, seed oils, which are terrible, and lectins, and maybe oxalates, then, a lot of times what you think may be SIBO may go away. So when you think about intestinal disorders like IBS, irritable bowel syndrome, try an animal-based diet. When you're talking about IBS-D with the diarrhea part, very common, try a carnivore diet for a while. When you think about GERD, acid reflux, try a carnivore diet. When you think about gallstones are really because you have a choline deficiency, decreased bile acids. So they say eat liver, meat, eggs, and egg yolks especially. Raw liver is actually good for you. I know it's kind of hard to stomach, so you may want to take the capsules instead, but raw liver is actually good for you. It has so many minerals in it. It may be the best nutrient supplement you could ever take, to be honest with you. You need to get rid of the beans, the lectins, the vegetables when you have this, and the sugar. I think sugar is just the worst thing you can do. I know I didn't help myself by having a little bit of sweet tooth when I had some cravings during the COVID, which, by the way, was very mild on the second go-around. It was like a 2-day cold. But I think it did affect my GI tract more than the first round, which is more of a sinus infection for me. Another tip is vitamin D. We always circle back to vitamin D. So people need to get out in the sun. That's the best way you can get vitamin D for sure. And when you take vitamin D, you need vitamin K2 with it. I always preach that. But vitamin D really helps your gut microbiome, without doubt. I've long loved raw, unpasteurized, local honey, and that turns out to be very good for your gut too. It's an animal-based product. Kefir, raw milk, if you can find it. And there's another kind of milk that I actually started drinking and tolerating very well, because I know I've got a lactose deficiency my whole life and probably a little gluten sensitivity as well. That's one thing that the Digest Shield, which is the one product that really kind of helped besides the diet, helped me with that a lot. But that A2 milk um, is really good for you. So when people say they have like a lactose deficiency, it may well be that they really can't, they can tolerate certain types of dairy, but when their gut microbiome is straightened out, they'll be able to tolerate the dairy more. Certainly, the A2 milk is much healthier than the regular pasteurized milk that you see. You know, it's hard to find raw milk and goat milk, but those are actually pretty good for you too if you can find it and tolerate it. But so it turns out that a carnivore diet can be pretty helpful for some people, especially those with autoimmune disorders. Go back to Dr. Gundry's work, that cardiovascular surgeon that's turned nutritionist. He sells a lot of products, but he's pretty knowledgeable. I use his autoimmune diet quite a bit, and again, it's going to be a very low carb diet, almost a carnivore diet, really, to be honest with you. So if you have these autoimmune issues like ulcerative colitis, Crohn's, even chronic pain, and maybe even some mental disorders, can be helped greatly by eating a carnivore diet. Um, One reason is because it's low in omega-6 fats, those inflammatory fats that we measure in our Cleveland Heart Panel. Um, the worst one being linoleic acid. You know, that probably is much worse than high cholesterol as far as your health overall. Um, it also, when you get on a carnivore diet, it's really low on these omega-6s. It's also removes oxalates and lectins, those plant proteins that are really, turns out, kind of bad for you. You know, oxalates, you find them, they're high in spinach. You think spinach is great for you, but in some people, maybe not, because the oxalates in that spinach kind of bind the calcium that may be good for you, so it's unavailable for you nutritionally. I'm not saying there's not good things in spinach and other vegetables, there are. But if you're not able to capture the nutrients because there's too many lectins, which is another way a plant protects itself from being eaten. And they surely don't want the seeds to be eaten because they wouldn't reproduce. They don't mind if you eat a couple leaves off of them, but it's the seeds. That's why the seed oils are just the worst. I mean, the seed oils are terrible, like sunflower or safflower oil. When you look at that and that's in your ingredient list, don't eat it. These omega-6s, oxalates, lectins, they trigger inflammation, which causes all disease. The other thing that's good about carnivore diet is it increases something called carnosine. And that carnosine is really good because it really attracts glucose. So it reduces your blood glucose levels and lowers your chance of diabetes, of course, or something called advanced glycation end products, AGEs. And that's where you have glycation, which sugar will bind to a protein, and it's bad. It's very inflammatory. It makes your arteries sticky. And so the carnosine in a carnivore diet really helps bind that up, and then it goes out as waste. So that's very good for longevity as well, and weight loss. One of the criticisms of the carnivore diet that's long-standing is that it may cause heart disease because of the saturated fats in it. Well, even the American Heart Association very recently has they have agreed that saturated fats do not cause heart disease. So that's something we've preached for years. So really, it's not your cholesterol that causes heart disease. You have to look at it in detail. It's not just the total cholesterol or even your LDL. A lot of it boils down to your ApoB, which we measure in that Cleveland Heart Panel, and insulin resistance and other risk factors like your blood pressure. Do you have diabetes? Are you a smoker? So really, when we're just hammering these statins out, on everybody who has a slightly elevated cholesterol, it's probably not the right thing to do because they can cause side effects for sure. And it turns out you need cholesterol to make your cell walls and make your hormones. It's along that steroidal pathway. Um, Testosterone comes directly from cholesterol, as we always say. Um, so the carnivore diet is really very low in the unhealthy fats like the linoleic acids and the PUFAs, the polyunsaturated fatty acids, and seed oils. They're not part of your natural human diet. And that you get those through processed foods. So if you cut out processed foods, you're doing yourself a big favor. The worst fats are really the seed oils. And you find that a lot in chicken and pork. You know, when we talk about Dr. Saladino's diet, he doesn't eat fish because of the toxins in the waters, and he doesn't eat chicken or pork. Oh, he just eats red meat, and now he's eating certain fruits, seedless fruits that are low glycemic, and he also eats honey, which he says is great, which I agree with him. I love raw, local, unpasteurized honey. I have it at every office. And a lot of the problem with the chicken and the pork, they have high amounts of linoleic acid thanks to the grains they're fed. When you eat red meat, again, so when you eat, if you get on a carnivore diet and you're eating a lot of red meat, which you will be, then you have to get grass-fed, grass-finished beef. And it's very available. You know, some people say, oh, I eat grass-finished beef. It has to be grass-fed and grass-finished. When they say grass-finished, it means they were grain-fed in the first part of their lives. At the very end, they were fed grass to make it look like they were true grass-fed animals. They weren't. So it's got to be grass-fed and grass-finished. And they're a little more expensive, but when you consider you're going to cut out all the other bad stuff and the junk food you're eating, you're going to be very full. You're going to have more energy. You're going to be less inflamed. Your gut will thank you for most people. You know, another thing about the animal-based diet is the protein in it. It's much more bioavailable than plant proteins, double, really. So you're getting a lot more protein, which builds your muscle, burns fat, more so than plant proteins. Now, I'm not saying, you know, that a vegan diet or a vegetarian diet is bad for everybody. There's certainly nutritional deficiencies you can certainly get from those. So I don't tout those a whole lot, but you know, there's certain people that do feel better on them. But so again, everybody's a little bit different. But so if your health and your gut are already optimal, don't change a thing. But if your gut's unhappy, and you know when your gut's unhappy, you have a lot of gas, bloating, irregular bowel movements, constipation, diarrhea, GERD, if you're overweight, if you're tired, if you have brain fog, there's a huge brain-gut connection, then you know you need to think about maybe trying something a little bit different. I'm certainly not against trying a carnivore diet. I certainly did it, and it helped me. So whether you follow it by Dr. Saladino or Dr. Baker, you know, see what it can do for you. Even if it's for the short term, and you readjust a little bit. Again, I don't think anybody's going to stick to those strictly long term because they're going to kind of learn a lot about modification. And as Dr. Saladino learned himself about adding some fruits in there, low glycemic fruits and ones that didn't have seeds in them. So in the end, hopefully you can straighten your gut out. You'll learn something about your own system because if your gut's not working, you're going to be prone to all kinds of inflammation, autoimmune diseases, brain fog, weight gain, all the stuff that you don't need. So it's just another thing that you can consider doing and trying for your gut first and then for your overall health if you're not happy with it. So read about the carnivore diet, and you know certainly if we can help you out with it. We do a lot of studies of gut function, and we do a lot of different things with nutrition and weight loss and hormone management. It all kind of ties together. So I hope this has helped you. We're talking about the carnivore diet. If you have any questions, don't hesitate to ask us. Thanks. This is Dr. Tom Rogers.